Hello, everyone, and thank you for joining us tonight right here on The Mike Lee Show, sponsored by the Queen, the icon herself, Miss Jamie Foster Brown. And tonight, I am honored to have the one and only Rickie Fairley with us. Rickie is an award-winning seasoned marketing veteran that has transformed her life into helping others and breast cancer advocacy. Rickie co-founded and services as CEO of Touch the Black Breast Cancer Alliance. Ladies and gentlemen, my guest today, the beautiful Rickie Fairley. How are you, Miss Fairley?
I'm great. Thank you for such a sweet introduction.
It's all true. I'm going to get right down to the meat and bones. It is such a pleasure to have you here with us tonight, and we want to get educated, and we want to find out some things that are going on with what you're doing. First of all, explain to us what stage 3 triple negative breast cancer is. What is that?
Okay, so triple negative breast cancer is the worst breast cancer. Black women get it at 3 times the rate of white women. We don't really know why. It's the only breast cancer that doesn't have a drug to prevent recurrence. You know how someone will take a drug for 5 years, right? We don't have a drug. And really, we've only had targeted therapies for triple negative in the last 2 years have been approved by the FDA. So we really haven't had a drug. So basically the way to describe it is there's 3 kind of main breast cancers. There's a lot of there's a lot of forms of breast cancer, but it's like 3 ways treatment can go into a cancer cell. One is based on estrogen. One is based on progesterone, which you've heard of, hormones. And one is based on an enzyme called HER2. If you don't have any of those 3 portals, it's called triple negative. Meaning, guess what? There's no way for the medicine to get into the cancer cell. So it's a really tough disease to treat. It affects young Black women at early ages, and it comes at later stages because they're too young to identify it. And it's killing us in a lot of numbers. I'm very blessed to be here because it's not a good one.
Wow. How did this change your life?
In every way. I really kind of quit my life and started a new one. So I think that, once you've had breast cancer and a disease like that, my doctor gave me 2 years to live. I'm on 10.
Wow. I was going to ask you about the survival rate.
Yeah. So the survival rate is really low. And I know I'm blessed to be here. I know that God left me here to do this advocacy work because I have so many breasty sisters that, didn't make it through what I had. And it's a really nasty disease. And you learn, you kind of learn a new life with it because you lose your filter. So you'll say anything to anybody, right? You lose your decorum a little bit. And, but also it makes you just think about how you want to spend your time and who you want to spend it with.
Explain to us how Black breast cancer is different from other cultures having this disease. Is there a difference between the body health genes?
Yes, so only about 5% of breast cancer is genetic. Okay, so that's definitely a factor. So if your mom had it or your grandma had it, you should get genetic testing, or they should get genetic testing. But Black breast cancer is different because our mortality rate is 41% higher than white women. 41%. Black women like me who've had breast cancer, we have a 71% higher relative risk of death.
Wow.
Black women under 35, this is one of my worst statistics, Black women under 35 get breast cancer at twice the rate of white women and die at 3 times the rate, well before they would get their first mammogram at age 40. And Black women have a 39% higher recurrence rate. So why are these statistics happening? And you know what it is? When you start to dig into the science, we don't have any science for Black bodies. The drugs that are kind of standard of care now were made like 20, 30 years ago. And guess what? There were no Black women in those clinical trials. There was no Black women in that data, in that science, right? And even since then, the percentage of Black women in clinical trial research is only 3%. So the drugs that are available in the market have not been tested on Black women. And so we don't have science to understand why these death rates are happening in such crazy numbers.
That brings me to my next question. Why isn't the FDA pushing more for Black women to be a part of the research process? It is so important. Our women are dying faster, so why not have them involved in the process?
So there are a lot of, the FDA has sort of mandated, but, they're not really enforcing it, and pharma's getting away with it. And so that's some of the work that we're doing. We actually are doing a big a lobby event in Congress on March 3rd, because we want to bring this conversation and bring legislation about it. Because even though the FDA talks about it and has, well, you know, you should have more Black women in the research, it's not happening. And the pharmaceutical companies are getting away with it. And even the most recent drugs that have been made available or kind of been approved by the FDA only have 3 or 4% participation. And until we get that, we're going to still have people dying. Also, there's a lot of other things even besides drug therapy. For example, mastectomies, right? You know, these are my little fake boobs. They're bigger than the ones that tried to kill me. But there's a recent study that says that getting a lumpectomy, like taking the lump out and doing radiation, is equivalent to getting a mastectomy, cutting your boob off. Well, guess what? I don't believe that's right for Black women. And when you look at the study that was done, it was done in Sweden. So, you know, there are no Black women in Sweden, right? So we don't have the science for our bodies, and the drugs are not working for us. The therapies are not working for us, and the standards are not working for us. We shouldn't wait until we're 40 years old to get our first mammogram.
Wow. You are a founding member of Black Data Matters. Please tell us about that. So
when I first started digging into understanding, you know, why Black women are dying so much, it's because we don't have research. We named this campaign Black Data Matters. We wanted to bring attention to the data. Who's mining the science? Who's managing the data? And that has now evolved into a movement, which I launched 2 weeks ago, that I'm very proud of, called When We Trial. And our movement is all about getting the data. It's about making Black women comfortable with understanding what a clinical trial is, how it works, and why it's so important. And, you know, there's a lot of earned mistrust in the medical system. You know, Henrietta Lacks and syphilis and all that stuff is swirling around in our heads. But there's a lot of laws in place to protect us. And when you look at the way clinical trials are described on Dr. Google, you know, you go to Dr. Google and try to figure it out. Information is not clear. It's not understandable. It's not written in a way that makes people comfortable and helps them get it. So we've launched this campaign, When We Trial, and you can go to our website, whenwetrial.org, and we've tried to write a description of what the research is all about in plain language for Black women. And instead of saying Black women this and you this, and it's all about we and us. Because I wanted to communicate and educate our community in a way that's going to be meaningful and relevant to them. And so that's the purpose. And it's really to get people comfortable. And if you think about it, that Advil you took for a headache, last time you had a headache, that Tylenol you gave your baby, it was in a clinical trial, right? Everything was in a clinical trial. And so we don't get that. People say, oh, you're going to get the sugar pill and die. Well, guess what? There is no sugar pill in cancer research. You're going to either get standard of care, which is a drug that's currently on the market, or potentially a new drug that could save your life. But you're never going to be without treatment. And, you know, they'll say, I don't want to be a guinea pig. Well, you're not a guinea pig. You're advancing the science. You're helping yourself. You're helping your community. And Black women, we're all these badass powerhouse people with the purple cape, taking care of everybody. I'm a superwoman. I can do it all, right? So do it for your daughter. If you don't want to do it for yourself, do it for your daughter. Do it for your granddaughter. I have 3 precious granddaughters, 4, 2, and 10 months, and I work for them. You know, I've got about 4 years before Belle gets boobs. I don't want to have breast cancer by that time. And so do it for your daughter. Try to advance the science, save your own life, but also help our community, help your family. And so, you know, just basic understandings about how a clinical trial works and that it is safe. You get a lot of supervision, more supervision than you would get with any other treatment, because the doctors are all over you looking at every symptom. So you get better treatment. And frankly, because the drugs that we have weren't tested on Black bodies, any chemo you take as a cancer patient is a clinical trial in your body. So for me, I took the standard of care drugs and they didn't work for me. My cancer came back. I had to do more drugs, and I did some experimental drugs at the time. But every time you take a drug as a Black woman, you're doing a test on yourself anyway, because we don't know how it works on us.
Right. Yeah.
Right.
Exactly. You're also an advocate for patients by way of working with pharmaceutical companies. Tell us how you've been able to impact that area.
So thank God for George Floyd and for COVID, for bringing health disparities to the table and making Black people important in the health realm. What a concept, right? And so I feel like now we have a seat at the table, and I've like fought my way into pharma to find a seat at the table, and I'm not budging until we get rid of this horrible disease. And so I feel like pharmaceutical companies, they're getting that they're not reaching Black women. They're getting that 3% participation isn't good, and so they've opened their arms to us. And I thank God every day for the relationships I've been able to build with the companies in the breast cancer space, because I feel like they are listening. They want to hear us. They want to do it differently, and so they're funding our efforts, and they're helping us. They're asking me to sit on conversations about how to talk differently to Black women. And I'm not a scientist or a doctor, I'm a marketing person, but I understand messaging, and I understand how important it is to communicate in a way that's going to be effective and relevant to an audience. And I'm a Black woman, I know how to do this. I'm a breastie. So I feel like they've welcomed these conversations, and I feel very blessed that we're able to have them now.
Men, we were talking about George. How do you find that men are going through some of the same things? We never hear about men and chest cancer, breast cancer. Men. Well, tell us a little bit about that. Is this out there and we just don't hear about it or know about it?
Yeah. So male breast cancer, and it's breast cancer, it's not chest cancer. We
want to be macho and call it chest cancer.
I got it. You know what? Call whatever you want, but check for it, right?
Got it.
But male breast cancer is about 1% of breast cancers are men, okay? But guess what? Black men get breast cancer at a 50% higher rate than white men.
Wow.
And it's usually at more advanced stages. And Black men die at a 66% higher rate than white men. So we're not catching it early. And frankly, if there is a genetic situation in your family, a man can pass on cancer to their daughter. And now we're finding some linkages between prostate cancer and breast cancer. Oh. So if a dad has prostate cancer, he could potentially give his daughter breast cancer. So if you do have cancer in your family, it's really important to get that genetic testing and make sure that your family is okay. And it's best, it really works to test the person with cancer if you can. Now, clearly, if they've died, you can't. But if you have a history, you really should, get checked for genetic, because there are things you can do prophylactically not to prevent it, but you can, take precautions for it or get more screening. But men are definitely, at risk here, and they're finding it at later stages, and they're dying more readily.
Wow. Out of all of this, what are you most grateful for?
I am grateful for my life. I'm grateful for my family. And I had to learn that my peace is non-negotiable. A lot of the changes I made, I told you I started a new life. I had to get rid of all the cancers in my life, not just the one in my breast. And I made a lot of changes with the people I interact with how I spend my time. And I really value the fact that my peace is non-negotiable, and when I don't feel peaceful, I will leave the room. See, bye, I'm out. And I spend time with people who give me joy, and I do things that give me joy. And I think that don't wait till you get cancer to find your peace.
Beautiful. That's beautiful. One more question before we leave. Inspiration, because you've definitely been through some things, but you would never know it. Just looking at you, look right here, looking at you, not a problem in the world. What inspires you to go on and fight for everyone who can't fight for themselves?
I fight like a girl for my grandbabies. And I have 2 beautiful daughters and 3 beautiful grandbabies. I hope to get some more babies. I fight like a girl every day for my girls. And I don't want them to ever experience what I experienced. I don't want anyone to die of breast cancer, but I at least want Black women to have mortality rate parity. But I fight for my girls. They're my inspiration every day. And my hashtag is GSD. I don't know if I can say those words on camera, get shit done. But
you can do it. It's an
It's for my girls.
Oh, that's
it's
wonderful.
It's for my girls.
Well, I want to thank you for joining us tonight. This has been incredible to have you on. I was so excited today to have you on. And a friend of mine, her name is Juliet.
Juliet, my Juliet.
Yes, she's a singing something, but I wanted to surprise her and bring, oh my God. We'll pop her picture up on the screen, but I love her and adore her. she's always working and doing things for other people, and
She is.
I'm trying to cope with the things that she's going through. So I'm dedicating this interview tonight to her and to everything that she does. And I want to thank you for joining us, and thank you for putting yourself on the line to fight for women and men out there who are struggling with this. And so much joy to you in everything that you do. Let everybody know how they can join your website or social media and contact you if they need you.
Sure. Most importantly, go to whenwetrial.org. That's our new website talking about clinical trials. My foundation website is touchbbca.org, TOUCH, B as in boy, ca.org. And I'm on Twitter and Instagram and Facebook at touchbbca. And my personal Twitter is Rickie Dove, RICKIDOVE. And I'm so glad you talked about Juliet. She spent a week with me last week. We had so much fun hanging out in my house, and we just made a really, really cool video of a song she sang for our When We Trial launch. So check it out.
I will. She's amazing. Love her to death.
She's amazing.
She's amazing. Yes. Thank you so much. I know you've got to run. You've got a 6:30. Want to give you a little time to get you some water or whatever you need to do. Thank you so much for joining us tonight.
Thank you
we will
so
be
much
talking.
for having me.
We'll talk to you again soon when you're doing something else large. But thank you and have a good night, everybody.
Thank you.
Absolutely. Thank you for joining us tonight right here on the Mike Lee Show, sponsored by the one and only Miss Jamie Foster Brown, and we will see you all next time. Thank you so much, Rickie. Bye-bye.
Thank you. Hugs to Jamie. Bye.
Absolutely. She's going to love this.